My specialty is in women and heart disease, but both men and women, the number one cause of death is going to be heart disease. So when we talk about heart disease, it could be either a heart attack, stroke, or vascular disease. And some of the statistics we'll run through quickly. 1 in 31 American women die because of breast cancer, and 1 in 3 dies because of heart disease. And heart disease causes more deaths, and when we look at the statistics, it's 1 woman every minute. And 90% of the women have 1 or more risk factors for developing heart disease. So when we talk about prevention, we talk about 3 types of prevention. One is called primordial prevention, then primary prevention, and secondary prevention. So primordial prevention is where you want to prevent development of even the risk factors that can lead to atherosclerosis or heart disease. So certain things you can help prevent and some you cannot. So things you cannot are age, race, and family history. However, when people want to make a healthy choice, they can help control their cholesterol, smoking, high blood pressure, keeping diabetes or prevention of development of diabetes. Physical activity can be improved and also help curtail obesity. So the basis of everything is going to be atherosclerosis. In layman's term, it's hardening of arteries. You have heard all your patients say, oh, my mom had a heart attack, or my dad had a heart attack, my cousin dropped dead suddenly, but it's all at the end plaque buildup and in the arterial walls, and the technical term we use is called atherosclerosis. And when atherosclerosis progresses, it causes coronary artery disease or coronary heart disease. So when it affects the heart, we call it's causing a heart attack. When it is limiting the blood flow, people experience a symptom called angina, and they come to the cardiologist or to the regular doctors. And when it affects the brain, we call it an ischemic stroke, and when it affects the other systems, vascular systems, it's called the peripheral vascular disease. So the first thing we are going to look at is how can a plant-based diet help reduce hypercholesterolemia, which is one of the major factors that helps promote plaque buildup. So this is just a pictorial diagram from Vitality Cardiology, talking about the different stages, talking about inflammation, thickening of, then there is plaque buildup, there is a vulnerable plaque that ruptures, and when the plaque ruptures, the end stage is going to be when the blood clot gets attracted. We end up having acute coronary syndrome, different forms of heart attacks. So the question is fat deposits at old age. What I want to point out is, or I think the answer is already there, at what age does plaque starts to build up? It starts as early as 2 years, correct? So from first decade, and this was published by Pepline in the American Journal of Cardiology in 1998. So it's extremely important not to wait, okay, I'm 40, 45, now I'll start making a change. We have to start helping our kids understand the importance of prevention of atherosclerosis, because it starts to build up as early as first decade of life. So where does cholesterol, serum cholesterol, so when we do a blood test, we all talk about LDL, which is the bad cholesterol, and HDL, which is the good cholesterol. So there are 2 sources of cholesterol, food, and on top of that, the liver produces cholesterol. So if you look at this little diagram here, it talks about 65% of the cholesterol comes from the liver and other cells throughout the body, and then 35% comes from what we eat. So when people say, I have a genetic background, yes, it is a 65% where you can try to make lifestyle changes, make some changes that can help. But this 35% is in everybody's control, where you can eat healthy. So one of the things that has been shown again and again is exogenous sources. All foods containing animal fat and meat products are rich in cholesterol, and high levels of cholesterol intake can cause increase in serum cholesterol. So this is an article published in the American Journal of Clinical Nutrition in 1999, talking about standard American diet. How much does it affect the serum cholesterol? It's about 200 to 10. A vegetarian diet does bring it down. definitely proportionately down on the LDL, because LDL is the main culprit that we worry about when your doctors ask people to take statins or other things. We are more concerned about the LDL. And in a vegan diet, you can see that it is proportionally even much more. So just by changing the diet, you can actually cause a change in your total cholesterol and in your LDL cholesterol. So animal products are rich in saturated fat and cholesterol. Both saturated and trans fats have the greatest effects on the serum cholesterol. The other ways it affects is insulin sensitivity. Improved insulin sensitivity reduces cholesterol synthesis and thereby leads to less atherosclerosis or plaque buildup. And then the other important thing we need to know is there is markers called lipoproteins. These are called lipoprotein little a and little b. They have been shown again and again to be related to cardiovascular risk. And studies have shown very clearly that a plant-based diet reduces LP little a, and prospective studies have shown that vegetarians and vegans have the lowest levels of LP little a and LP little b, and this was published I think both Amanda and Stuart Rose had written an article. So that is one way, is one of the ways where cholesterol becomes more of an issue is getting oxidation. So LDL cholesterol that gets oxidized is the one that becomes the culprit or the basis for atherosclerosis. So one thing that has been shown by studies is there is evidence that the LDL cholesterol in the vegetarian population is much less oxidizable, and that is one theory by which we can know that LDL cholesterol levels, as well as in the final event of having a heart attack, is less. The other mechanism that we are looking into is the bacterial flora. So they studied people who are vegetarians and vegans and looked at the bacterial flora in their gut. And what they found out was the TMAO, which is trimethylamine N-oxide, which is thought to be atherogenic, which is the basic cause. It is less in the vegetarian diet than the flora of the meat eaters. And this was published in the Nutrients in 2014. So this is another mechanism by which how cholesterol levels are lower and causing less events. The other important marker is usually inflammation, and studies have shown that plant-based nutrition program reduces the high sensitivity C-reactive protein. The other important thing we talk about in cardiology is nitric oxide. So nitric oxide was voted as the best molecule, and the three scientists here, Robert Kochwart, Ignaro and Dr. Murad, they won the Nobel Prize for finding out nitric oxide, which is essential to vascular health. And in vegetarians, they have a better way of having nitric oxide. So this is the nitric oxide production pathway, and here we are showing arginine, which improves nitric oxide synthase, and L-arginine is present mainly in plant-based products. So plant-based nutrition has a beneficial effect on endothelial cells responsible for nitric oxide production. Nitric oxide in turn relaxes blood vessels, prevents white blood cells, platelets from aggregating, keeps the smooth muscle cells from proliferation. So this is actually acting against all the atherosclerotic behavior the others would produce. It even diminishes vascular plaques, and L-arginine that we talked about is the amino acid responsible for the nitric oxide production, and that's mainly found in legumes, beans, soy and nuts. And so in conclusion, vegetarians have better flow-mediated vasodilation, and they also have better nitroglycerin-induced vasodilation. The other theory is advanced glycation end products. So these products tend to block nitric oxide activity in the endothelium, and it causes the arteries to become stiff and increases the vascular permeability. So when we look at the AGE, the advanced glycation end products are found in higher concentration in meat, and dairy products done in plant foods. So if you look at butter, has like 10,000 units per gram, meat products is about 1,000 to 10,000 units per gram, whereas in plant-based diet it's only about 100 units per gram. And other things that we talk about causes for atherosclerosis is inflammation. So vegetarians demonstrated a lower blood concentration of C-reactive protein, marker for inflammation compared to non-vegetarians. They have a better antioxidant status compared to omnivores, and vascular effects include a thinner carotid IMT. I think people who are here earlier must have gone through some screening with the IMT, which is also used as a surrogate marker for atherosclerosis. So more fruits and vegetables the better. It increases endothelial nitric oxide in a dose-dependent manner. Fruits and vegetables mitigate increase in vascular stiffness. Then the other things are, there are plants also have stenols and sterols, which are found in vegetable oil, nuts, grain products, and definitely more plant-based diet has viscous fibers, and viscous fibers up to 5 to 10 grams a day, up to 25, can help bind the cholesterol and bile acids in the GI tract so that they don't enter into the vascular system to cause atherosclerosis. So that is another mechanism by which it acts. So are we ready to say, let food be thy medicine and medicine be thy food, which has been said by Hippocrates, who is the father of modern medicine. Will going vegan and vegetarian reduce the risk of heart disease? So forks over knives. So this is the picture of Dr. Kim Williams, who is the former president of the American College of Cardiology. I think he was the president about 2 years ago in, or 2016. Yes, going vegetarian makes a big difference. No matter large or small, research studies have been showing a strong evidence that vegetarians have lower rates of coronary heart disease, definitely lower LDL cholesterol, lower rates of high blood pressure, diabetes, obesity. So he goes to say, wouldn't it be laudable goal of the American College of Cardiology to put ourselves out of business within a generation or two by following a plant-based diet, which I have to totally agree with. So let's look at some of the studies that were done, and we'll quickly go through this. So in 1960, this was kind of a very good landmark study. So at that time, it's very important to note there were no statins, there was no major surgery offered, no stents. Stents came into mostly around 1990s. So 50 patients with confirmed coronary artery disease were placed on a moderately low-fat vegetarian diet, and the other 50 were in the control group. By the end of 12 years, everybody in the control group had died. 19 of the 50 patients treated with the plant-based low-fat vegetarian diet survived. So not having neither stent nor cabbage surgery nor cholesterol reducing drugs were available. I think this was a very good notable study published in JAMA in 1960. Then we all, or most of us, are aware of Dean Ornish's program for reversing heart disease. He's the professor of medicine at the University of California, San Francisco, and the founder of Preventive Medicine Research Institute in Sausalito, California. So he had this article published in 1998. So he took a group of 48 patients. 20 of them were put into a control group, 28 followed a plant-based diet. Then he went about looking at them, looking at their cholesterol after 1 year and 5 years, and all of them had an angiogram to look at how much is their blockage, both at the end of 1 year and 5 years. And then obviously we look at events. Did the patient have a heart attack? Did they have angina? And in all aspects, it showed that there was improvement, 91% reduction in angina, whereas in the control group there was an increase, and the diameter stenosis had regressed by about 7.99% compared to worsening of the stenosis of 27.7%. So overall, the conclusion is 82% of the experimental group patients had an average change towards regression. So comprehensive lifestyle changes will be able to bring about regression even in severe coronary artery disease, even as early as 1 year of lipid lowering drugs. This is a very good article that was just recently published in 2016. So this is a sub-analysis from nurses' health study and the health professionals follow-up study. So they looked at 131,000 participants from the nurses' health study and about followed them up for quite a long time. And then they analyzed the data, and the conclusion was median protein intake by most of them was 14% for animal protein and 4% for plant protein. After adjusting for major lifestyle dietary risk factors, they showed that plant protein was associated with lower mortality, and they were confined to participants who already had at least one risk factor. So replacing animal protein of various origins with plant protein was associated with a lower mortality. So high animal protein was positively associated with mortality. High plant protein was inversely associated with mortality, and substitution of a plant protein for animal protein, especially that from processed red meat, was associated with lower mortality, suggesting the importance of the protein source. And then there have been many studies published about the mortality in vegetarians and non-vegetarians. This was analysis from 5 prospective studies. They showed mortality by ischemic heart disease. So IHD stands for ischemic heart disease, was 24% lower in vegetarians, and the lower mortality was actually seen in the younger age groups. And people who followed a vegetarian diet for more than 5 years were noted to have the best benefits. So these were the studies that were used in that particular article. And there was a smaller study done in India showing that when they looked at the coronary lesions, when patients followed a low-fat, plant-based diet, once again similar to Dean Orlish's study, there was regression. And this is another article from Esselstyn, and he did angiograms 3 years apart and showed that a plant-based diet, actually the distal LAD had plaque and it did improve after being on a 32 months of a plant-based diet. And the other thing is about lower risk of coronary heart disease. This is an important study called the EPIC Oxford study. It was a European prospective investigation actually into cancer and nutrition, but as a part of the sub-analysis, they were able to show that vegetarians, they for a total follow-up period of about 11.6 years, looking at almost 44,000 men and women in Scotland, that they had 32% lower risk of having heart disease. So the reasons could be that their blood pressure was better controlled and their non-HDL cholesterol was under better control, which could explain why they had less events. The other thing we worry about is about the symptom that commonly we talk about is angina. So angina was also could be treated using a low-fat plant-based diet. They looked at 100 patients. After 12 weeks, 74% of the patients were angina-free, and this was done in the US in 22 different clinics. And 9% or an addition, so total of 83, moved from limiting to mild angina, and this was published in American Journal of Cardiology in 2008. I also serve as the cardiac rehab director, and compared to patients where they followed the regular cardiac rehab program where they talk about diet, exercise, stress management, when they combined this with a low-fat vegetarian diet, they found that 80% reduction in depression in 12 weeks, along with they were able to maintain less angina, more improvement in total cholesterol, less BMI, very good improvement in systolic blood pressure, LDL, and improvement was maintained at least at 1 year. So this is following a low-fat plant-based diet was additionally beneficial even in the cardiac rehab program. Coronary perfusion study was done 4 years. They showed that patients on a plant-based diet showed improved perfusion. So in conclusion, I want to say vegetarian diet mechanisms for lowering risk: definitely lower serum cholesterol, lower HDL, lower LDL, improved HDL, lower levels of the apolipoproteins, low glucose, better regulation of triglyceride-rich lipoprotein, lower systolic and diastolic blood pressure, lower levels of C-reactive protein, and lower BMI. So protein sources do matter. So compared to red meat, using a plant-based diet, just want to share this thought. 100 calories of steak is equal to 8 grams of protein with 7.4 grams of fat, whereas 100 calories of broccoli is 11.1 grams of protein with only 0.4 grams of fat, with additional essential nutrients, phytochemicals, vitamins that prevent heart disease and promote heart health. So I want to end by saying the quote from Albert Einstein: "Nothing will benefit health and increase the chances for survival of life on earth as the evolution to a vegetarian diet." So the treatment of coronary artery disease with a plant-based diet prescription would be a low-fat, less than 10% of calories from fat. A plant-based diet is a viable, cost-effective treatment, and this can be used in combination with standard treatment regimens including medications and or interventional therapy as needed, both PCI or CABG. So stress management, no matter what we do, is extremely important. Keep a positive attitude and wear a smile. It takes only 22 muscles to smile, but 37 to frown. Thank you.